Now we have a small disease given in your NCERT, that is what? Pernicious anemia. Pernicious anemia. Now this pernicious anemia, it is what? It's also given in your digestion and absorption, but it is not given as a disorder. Separate disorders it is not given. It is given inside the chapter. Chapter ka andar hai, अंदर portion, there you have this pernicious anemia, right? So what is pernicious anemia? That also we have to discuss over here. It is due to what? Case you have vitamin B12 deficiency. Vitamin B12 का deficiency will cause pernicious anemia. So pernicious anemia का main cause है what? Vitamin B12 deficiency. Why does vitamin B12 deficiency occurs? This deficiency occurs due to what? Cases intrinsic factor, abnormal secretion or synthesis. I will explain you what. You have a factor called Case's intrinsic factor, and this Case's intrinsic factor will bind with vitamin B12, and that will be helping in the absorption of what? Helping in the absorption of vitamin B12. And that is what is the main, this Case's intrinsic factor is the main compound or the main enzyme that is going to, the main factor that is going to help in the vitamin B12 absorption. Why you need vitamin B12, guys? You need vitamin B12 in order for the RBC. You have RBC, right? You have a binucleated, biconcave RBC, and this RBC, you all know RBC is not having what? Nucleus. RBC is not having nucleus. It is very, very important. Which I can give you a small question, guys. Very small question I will be giving you. Which is that animal that is lacking RBC in its nucleus? Which is having RBC in its nucleus? We all lack RBC in the nucleus, but there is a animal that is lacking what? That is having RBC in the nucleus. Please comment me the answer below in my comment section. This is a very important question also. This is a very important GK question too. Hey guys. So which is an animal that is having a nucleus in its RBC. So we are not having this nucleus inside the RBC, right? So we are, now what happened? When vitamin B12, it helps in what? Nuclear synthesis. Helps in nuclear synthesis. And also this vitamin B12 helps in, and also it helps in the RBC maturation. RBC maturation. I can give you this concept, I can explain you what it is. You have your RBC. This is one RBC. These are all, you have many precursors of RBC, guys. You have many precursors of RBC. This is what? Your normal, this is a precursor of RBC. You have BFUE, CFUE, you will learn a lot. Pro-normoblast, late normoblast, early normoblast, you will learn. But we don't have to go to all those details now for your NEET UG. I discussed in the NEET PG classes, right? So this is required for your NEET UG. So to understand the concept I am saying, this is the what? You have a lot of what? Precursors of RBC. Now the precursors of RBC, this is one precursor, this is another precursor, this is another precursor, this is another precursor, and this you have is your final RBC, your biconcave RBC. Now, this when the precursor cell on, these are the steps. On becoming the biconcave RBC, their size will be what? Actually, their size will be decreasing. Their size will be decreasing. Their size will be decreasing. Here it is a very big cell. Then its size decreases. Then it again decreases. Then it again decreases. Then its size become like this. Biconcave shape. Right. So their size decreases gradually. Big size, small, 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 small. So their size decreases gradually. So this is the mature RBC. Now, on maturation, their size decreases. And they have, this precursor will be having what? Nucleus. They have nucleus. But RBC is not having nucleus. So, vitamin B12 help in what? This maturation of RBC. So, my question is, if there is vitamin B12 deficiency, or if there is abnormal cases intrinsic factor synthesis, what is going to happen, guys? What is going to happen? Yes, there is going to happen what? Pernicious anemia takes place. Then what are your findings? Your RBC will be very large. Your RBC will be very large. You will be calling that as macrocytic RBC. Macrocytic. This is the application based question for your NEET. This is very, very important, guys. Macrocytic RBC. Macro means what? Macro means large or big. Cytic means shape. Cytic means shape. So macrocytic RBC. Macrocytic RBC is for what? Pernicious anemia. And your RBC will contain what? Your RBC will be containing nucleus also. You will be having a nucleated macrocytic RBC. That is the main finding in pernicious anemia occurring in vitamin B12 deficiency or in deficiency of or abnormal synthesis of caseous intrinsic factor. Write down.